Hi, my name is Jenny Okolo. I currently work as a lead occupational therapist and day center manager at a prison. I started off in the criminal justice system actually when I was training as an occupational therapist. So I went to Oxford Brookes University, and as most healthcare professionals, you do your placement throughout the 3 years. And I was lucky enough to have my placements in forensic settings, whether that was in a hospital or in a community. And I think initially, probably like most people, I was quite intrigued to see what happens in forensic settings like prisons or psychiatric hospitals, and seeing how healthcare and criminal justice actually marries together and what OTs can contribute to that particular area. So for me, it was very much out of curiosity. And then it kind of evolved more into, as I grew older and I was seeing what was happening around me in terms of crime, especially amongst Black men and Black people in general and ethnic minorities. I really wanted to understand the reasons why people from those backgrounds were getting into psychiatric hospitals or being sectioned or unfortunately having to go through the criminal justice system. So as you can imagine, a young 19-year-old, being exposed to these different settings at a young age, it definitely led me to want to work in that sort of area. So my first role, once I was qualified, was actually in a medium secure unit. And there I spent, I think, 1 year or just over a year. And, I worked as an occupational therapist. I worked alongside other professionals, doctors, nurses, care coordinators, social workers, all to support that particular person into, in their stay at hospital, rehabilitating them back into society, and also doing assessments and interventions to, again, support that person to have more of a meaningful life. And I really enjoyed it. And as much as I, enjoyed the whole experience, and again, it really, I suppose, helped with my understanding of different types of people, it was also quite a challenging field to be in. As you can imagine, working with people who have committed crimes or are very unwell mentally, it can, I think, drain you just in general as a health professional. And I think it's okay to say that because that's the truth. But, again, I think combining my curiosity, combining my passion for supporting those who, are unfortunately going through this process has definitely helped with that. And then more recently, as if working in forensic psychiatry wasn't enough, I decided to work in a prison. And again, I think whilst I was still curious, I knew that would be a totally different experience for me. And I'm sure, like myself, you've heard several stories of what it's like in a prison, the type of people that you meet, and it's a very much no-go area. But, I was wanting to go up in my banding, in my career development and progress onto a more leadership role. And I came across this opportunity and I thought, why not? And as you can imagine, I was in for a surprise, and it's definitely been a challenge, but additionally, it's helped me again unlock another side of the criminal justice system, mental health, and just the things that lead people to that particular place. One thing that I can definitely say that I've taken from it is just how much undiagnosed people there are in prison. And unfortunately, that's due to so many factors, whether that's economical, social factors, just, background in terms of like culture and just not knowing what mental health or all these different symptoms actually mean. A lot of my patients are unfortunately, undiagnosed, and it's really hard because the older that you get, it's quite hard to try and figure out, why is this person acting that way? And as much as medication and I suppose punishment, because it's a it's a prison, might seem like the ultimate way to resolve and I suppose, allow that person to, I guess, get the punishment or, whatever that society says. I think it's definitely much more than that. And again, it just made me realize like there is so much more to be done from the healthcare point of view, but then also from a societal point of view to ensure that we are reducing the amount of young offenders, offenders who are of ethnic minority, who are unfortunately filled within the prison. And it's definitely shifted my passions into wanting to just play my part, play my role, because I think it could be anyone that's close to us. It could be my brother, my father, just anyone who has unfortunately gotten to that place because they didn't have the right support initially. But yeah, I think it's, like I said, it's challenging, but I do enjoy my role. I enjoy the different professions that I've met. I enjoy working in a very unique environment. So working with Ministry of Justice and then of course NHS. And I hope that with this experience, I'm able to kind of further my career development and again, play a massive, or even if it's just a small part in the societal problems that we might face. So I think that's it for me.